Hi guys. I had a very interesting case this week. It was a 14-year-old male that came in the clinic for just a well check, and also during the assessment, he reported to the nurse that his hands get red at times. And this particular triage nurse decided to ask him also to take his shoes off. And when he did so, his feet were bluish red in nature. So he hadn't been in the clinic in 3 years. His hands were red from about here down and a little bit rough in texture on top. He endorsed washing his hands frequently, Dawn dishwashing detergent because he had to do chores at the house. And he's virtual right now, so he was using that particular hand soap. He also noted to have his hands and feet were very cold, and he says that his hands are cold often. He denies pain in the extremities. We placed a pulse ox and it was 100%. His pedal, his dorsopedalis, his popliteal, and all of his arterial pulses were present. He also denies any alleviating factors, and he reports being cold, and right after he gets out of the shower is an aggravating factor, or just going out into the cold is an aggravating factor. He denies taking any medications or herbal remedies for this. He also denies, and mom was with him, so mom denied any autoimmune diseases or family history. Thyroid, cardiovascular, and circulatory, there's none noted. So father, hypertension, mother, nothing. Maternal grandmother, hypertension, CHF, and maternal grandfather, COPD, and paternal grandfather died of unknown reason at age 38. So critical thinking about this patient, obviously it's a circulatory issue. Now we need to find out if it's primary or secondary. What I'm thinking it could be caused by autoimmune diseases. And he hasn't had a physical in 3 years, so we're gonna need some lab work more than likely. So what I did was, because there's no pain, there's no trauma, no medical history, and in researching it, you understand that Raynaud's has an onset of between 15 and 30 years. But it is a disease that is associated with a lot of autoimmune diseases, such as scleroderma, systemic lupus, Sjögren's, Raynaud's, and that's something that needs to be investigated. So at this point, we're able to diagnose him with Raynaud's, and the way we go about doing that is through Up to Date, which is a phenomenal resource. I absolutely love it because it really explains the disease process at so many different levels, and it explains what you need to tell the patient, in depth ways to tell the patient and how to go about it, the signs and symptoms, diagnostic measures, tools. But we also, the clinic that I'm at has a residency program for physicians there, and so I'm doing that program. So it's really cool. So we were able to go over and ask the residents, hey, what is your thought on this? And they also decided that it was Raynaud's as well. And the reason being is because there was no pain. It was the reversible color changes with warmth. It's not something that he has all the time, like would be present with vasculitis or something, or other systemic diseases or autoimmune diseases. And so we do obviously need to order labs to ensure that they aren't these autoimmune diseases. And some of the labs we ordered, like the SED rate, because it shows inflammation, anemia, infection, so like RA, vascular disease, whatnot, CPRC, reactive protein for autoimmune diseases like RA and lupus. We did a CMP and CBC with DIF, and that's more for like rule out, but also to assess for anemia. And then we did an ANA, which is according to UpToDate, like the standard, because that rules out autoimmune diseases like lupus and whatnot. And then another disease that's associated with it is hypothyroidism, or excuse me, thyroid disease. So we ordered a TSH and a T4. And then all of these labs, by the way, came back 2 days later, completely normal. So our initial assessment of Raynaud's disease, primary Raynaud's, was accurate. There is, UpToDate did mention one thing, that when you evaluate a patient, you ask them three things. And if those three things are positive, then they're obviously positive for Raynaud's. And these things were, are your fingers usually sensitive to cold, which the patient did respond to yes. Do your fingers change with color when exposed to cold temperatures? And obviously yes, because precipitating factors were going out in the cold and after his shower. And then the third one is, do your fingers turn white, blue, or both? Well, his fingers were red because obviously that's the after effect. But his toes, so his feet, were all here. They were this like bluish color, and then they're white. So with Raynaud's, I have it because I have hypothyroidism and I have Raynaud's due to it. Your right here will be a little blue, and then you will see red, and then there are these bands of white, like solid white. So when someone is able to say, do your fingers turn white or blue, that white is what they're referring to. There will be redness, but there will be these streaks of whiteness. And that obviously we attested that all three of these are positive. So that would be a positive screening for Raynaud's. So we were able to do that diagnosis. And the assessment plan that with him that we want to do, and obviously all the secondary labs were negative, so we're able to say that Raynaud's primary with no autoimmune diseases to speak of. Differential diagnosis would be, so more plausible differential diagnosis there was one, erythromyalgia, which is the same thing, which the patient would present exactly the same, but only it improves with cold temperatures and gets worse with warmth. And this was not the case with him. The coldness is what brought on his symptoms. And so the other differential diagnosis would be vasculitis, but reversible color changes with warmth. So that ruled that out completely. Some things that education, we were able to develop therapeutic relationship. So he was able to avoid sudden cold exposures so basically we told him, you need to avoid the cold. The cold is not your friend. It's obviously causing these problems with you. So he presented to the clinic in a t-shirt, and it's snowing outside, with jeans and no socks with his shoes, and just a very light jacket. So obviously we educated him about layering, wearing hat and gloves. Although they may not look cool, they're going to help your hands from being red. And I said, when your hands are cold, you just put them under your armpits, or rotate them like a windmill, rub them together. You want to get that warmth, and you want to stay warm, because that's what's causing it. And we did assess him for like alcohol, drug usage, smoking and whatnot, which were all negatives. And he's not on any medications because he doesn't have any chronic disease. He doesn't take anything over the counter. So he avoid smoking would be something another person would do, and then reduce stress in his life, which kids can get very emotional, and when you're emotional, this can bring about these symptoms and exacerbation. So just keep his emotions in check, and then avoid vasoconstricting medications like Sudafed and stuff like that. Go for something that's less vasoconstrictive so you don't get an exacerbation from that. By compounded by being cold. So basically, right now we're just doing a conservative effort versus an effort that involves medications. If we were to do medications, we would look at calcium channel blockers as a vasodilator, and that's something that we would use in treating the patient. But right now we're just going to use conservative measures, and we're going to follow up in 2 months to see how he's doing. We have already called him with the lab results, which were available 2 days later, and they were absolutely fine, and we let him know that. So what inspired me for this case was just because I thought it was going to be a very simple well check with maybe some contact dermatitis because he washed his hands so much. And in the end, it turned out to be Raynaud's, which is something that you typically don't see in males. You see more in females, and it's not something that you see every day in the clinic. You see more with autoimmune diseases. So it's kind of nice to be able to see something different. Thank you, and I hope you enjoyed my presentation. Have a delightful day.